So even with the setbacks and everything caused by the pandemic, we continue to thrive and serve our community by improving patient care. When I say improving patient care, I mean that there's only one goal of our facility. Our patients will always be number one. Our patients will always get the best care that we're able to provide, and if we're not, we'll assess and transfer them to the facility that we feel appropriate. 2021 has started off interesting. We have added Sam Atchison. Now Sam is from Wellington originally. He studied with Dr. Schmeidler that was with the Ark City Clinic, and he reached out to me, was working for an orthopedic surgeon in Wichita, and said he loved Ark City, loved the rural health field, and wanted to work with us. So we had an opening for Ark City Clinic Urgent Care, and we moved him in there March 4th. Mandy Wood is a nurse, has been at Winfield for years. She's finished her nurse practitioner program, and she will start working with our orthopedic surgeon, Dr. Ansari, June 1st. So a lot of my goals is always to continue to foster our community of people that are from here. So Dr. Green had moved to Alliance years before I came here, and there was an opportunity for her to leave Alliance and come back to Ark City. She still lived in Ark City, but was commuting. So she'll be joining us April 1st. And then a summary of where we're only in 3 months, but a summary of where we are this year is we had an eye doctor that came in before I got here that used to do about 30 cataracts a month, 1 day of surgery in clinic. It's always great for a hospital to increase their surgery opportunities twofold. It's profitable for us, and it keeps the money in the community instead of going out. But we did finally, after 2 years of looking, we have a new eye doctor that'll be coming for cataract surgeries in April. He'll come the 4th Friday of every month. We also have 2 new graduates that'll be family medicine with OB. So these young ladies will come in and want to deliver babies, do C-sections, and it's Dr. Lisa Ayala and Dr. Cora Rule. Now Cora is originally from between Douglas and Augusta, and then Lisa's from southeast Kansas, but she's been doing her residency in Colorado, and they'll be joining us this fall. Another thing that I was passionate about with the added addition of the clinics and everything is that I felt that we needed to have some sort of rebranding. So we started in March with SCK Health, and then you can see it's SCK Medical Center, SCK Clinic, and so I did not update this slide. So we have changed the part of the branding since here. So these will all be SCK, and we're going to market by location. So part of the rebranding concept is to make sure that everybody knows we have 3 primary care clinics. It doesn't matter if you go to the Ark City Clinic or the Winfield Clinic, you're going to have the same standard of care. We just hired Shauna Turner that had worked in the Winfield system for about 18 years as our director of clinic operations, and then she was with the Rock Hospital. And so we had an opportunity for her to join us, and she's going to bring our clinics to the level where it is consistent and we have the same policies, procedures, and if you go to Winfield, Ark City, you're going to feel like you're in the same clinic other than the building looks different. Now, the thing that I am most proud of is that SCK Health is the 4th largest employer in Ark City. When I came in, we had approximately 200 employees. In 2.5 years, we have grown to 265 employees. So not only have we had a great retention, we've had a great growth. And I am very proud of the people that are here. And there's a lot of people that have been with this organization for 20 to 30 years. And we just had our lab manager. She resigned after 32 years in January. So it's not like a lot of the companies now that you see the large turnover and everything. We have a lot of longevity, and I really am proud of these people. And I tell them all the time, I couldn't have done one of the things that I've done without your support and buying in and being able to provide the best care. So a lot of kudos to them. I've always been and will continue to be a strong advocate for Medicaid expansion. If any of you saw, there were some situations that I met with Larry Howley, and we took our disagreements to the paper for a while. It's been an interesting deal, but I'll pass on that right now, share a little more later. So this is the current status of the states that have not gone with Medicaid expansion. And you see in the umbrella, under the gap in coverage for adults in the state that do not expand the Medicaid under the Affordable Cares Act. They have come so far. I mean, we were so close. I mean, we literally almost had it voted by one vote. So, but there's just so much information. So why is expansion good for Kansas? It increases access to preventive care and improves chronic disease management. It helps hospitals in the community by reducing uncompensated care and helping hospitals maintain the firm financial footing. If we don't look at that for the financial footing, we already know that hospitals are giving a huge amount of bad debt and uncompensated care. So it keeps the Kansas dollars in Kansas. I'll even go further to say it keeps the Cowley County dollars in Cowley County. It's just good for business. The healthy workers take less time off, and it helps those with chronic conditions that are going to maintain employment. So it's going to create jobs by adding the money into the state's economy. This is the federal reconciliation bill, and I included the link just because there's so much information on there that I could not possibly share everything. But we do know that with the new incentives, that they're really encouraging us to, as Pam and I were talking, the late adopters that we've been, they're going to make it really clear that you need to make this now. There's just too many financial incentives for you not to. Currently, we have 425 beneficiaries in the Medicaid system, and the analysis based on not only our new additions with the expansion, but also on those 425 lives. The Kaiser Family Foundation projects off of the new plan that there will be a $250 million savings in 3 years to the state of Kansas. So all those politicians that have been telling us we don't know what it's going to cost us, you know, it's a huge savings. We'll have potential 250 there. I know personally, our hospital, the report shows that we would get about $1.3 million. Now, the city-owned hospital is not a nonprofit, it's not for-profit, so it's a little bit different. Our goal is just to basically get by and be able to keep investing into the operations, right? Well, until I got there, there hadn't been anything. There was no equipment that had ever been updated since that hospital opened. And we know in healthcare that 7 to 10 years is end of life for equipment in the hospital. And I say that loosely because most of them are operating on some sort of platform. So if Microsoft 7 stops, then we have to go to Microsoft 10. When I walked in the doors, Johnson Control System was on a Linux platform, and it went down. So I was trying to get it fixed, and they're like, well, you can do a Band-Aid for $18,000 on this, but you're going to have to switch to the new system in 9 months. So it's going to be 70-some thousand. So it was a lot of interesting things like that that have not been done with the hospital. But the key thing here on the $1.3 million for the Medicaid expansion, we currently are doing 3.7 to 4.2 million a year in uncompensated care or bad debt. So can you imagine if I got 25% of that and added that to where I could actually invest back into the hospital and the people there? The interesting thing is the governor is recommending the approval of medical marijuana in Kansas to generate the revenues. And there's so many people that'll jump right. And if you really get into the meat of the bill, it allows for the sales of oils, tinctures, extraction drops, plant material, edibles, and patches. It specifically prohibits smoking, combustible, or vaporized medical marijuana. So it's a very narrow niche. It's going to be for patients that truly need medical marijuana. I've seen it benefit in pain management. I've seen it in anxieties. and it's not going to have any products that are deemed attractive for children. So the patients will be required to carry an ID card. You can have up to a 30 or 90-day supply in your possession, and the medical marijuana would generate enough tax revenue to cover the cost of Medicaid expansion each year. I don't know if you guys are aware of it, but medical marijuana was already on the agenda before the governor said, let's use this for Medicaid expansion. So it's not like people are like, okay, well, let's do it for this. It was already being discussed, and now she just merged them and said, let's make this work together.
Yeah, it's a great idea.
Absolutely. And so Medicaid expansion, we've got the new legislation introduced in 2021. It's going to expand to 138% of the federal poverty level. You'll have work referral for those who are unemployed. And the premiums are not going to be more than $25 per person and not more for $100 for a family. And there will be hardship exceptions. So this is public information from the website. I understand that I may have failed because I didn't realize that Bill Riley was just for Ark City. I thought he was for Ark City and Winfield.
Yeah.
But you guys have
Cheryl Helmer.
Cheryl
Yeah,
Helmer.
and I have a sheet over on the end. I copied all three of their information.
Oh, wonderful.
Yeah.
Because I can't ask you guys enough, if you support Medicaid expansion, please make noise. The reason being, and I'll tell you, when I sat down with Larry Alley a month after he voted against it, he came into my office. I had another person with me, and he goes, I have a funny story to tell you. And I said, okay. And he said, well, when I voted first time, Alley's at the first of the alphabet, he said, I knew something was wrong because the whole room turned towards him. And so he said, but I fixed it at the end of the meeting. I realized I had voted for it when I should have voted against. So I changed my vote, and I said, well, Larry, we don't find the story interesting or funny. We are a hospital that wanted the expansion, so your vote took it away from us.
Yeah.
And so he proceeded to talk on some other things. And one interesting thing, I'm sharing too much information probably, but
You're all sworn to secrecy.
Larry has a way.
Women for Kansas.
Stays
said women for Kansas.
That's right,
Very
it's just
good.
like Vegas.
Well, he'll always say, if it's a difficult question, I'll answer any other question than that. And so, okay. So then I asked the next question, I'll answer any other question than that. And I said, you said that 3 times. Would you like to pick one of the 3? So, but what it came down to when we said at the end that he had changed his vote, I said, Larry, I said, I have to ask you a question because I don't understand politics. I've been a businessman for 30-some years in healthcare, but being with the city-owned hospital is really interesting. And I don't know what you know that we don't, because there's 10 hospitals in your district. I called every CEO, and 100% of us support Medicaid expansion. What are we missing? And he said that we're missing that we have no idea what it's going to cost the state.
That's their line all the time.
Yes. And so I will continue to be very supportive of Medicaid expansion. I think that it's negligent for a state not to take care of the people when we have an opportunity with the federal program. And so I hope that if you have an opportunity, reach out to Larry, whoever, make as much noise as you ladies need to make, and we would appreciate it. Now, that's really all I had in slides. Are there any questions?
Yeah. Some questions for Jeff.
So is the, oh, excuse me.
Go ahead.
Is there really any, I shouldn't say it like this. Let me try again. They're halfway through the session, right?
Yes.
Yes, they are.
Will the current Republican folks allow Medicaid expansion to really even come for a vote, do you think?
Not this year.
See, we've been, you know.
But what I feel from, if you have an opportunity, go into that link and dive into there. I feel like we have a window that the federal government's given all these incentives, and it's kind of like saying, this is your last chance. We're really going to help you cover your costs, make the right decision, and then if you don't, you're probably gonna be hit with penalties in 3 years.
Oh, well, there you go. So
I
So
it
they're
think-
gonna
would cost you
incentivize
even-
it.
So it would cost
Yeah,
us even without it.
yes,
I believe so.
they'll give
Well,
us
that's good.
Well,
penalties.
maybe that's, because, we've all had these conversations with them, and, to a point, I'm not at all afraid to ask the question or write the comment, but then they always throw it back at you, and it's like, he is so stuck in his theory, that then I kinda throw up my hands, because then it gets too deep for the common person to have a conversation, other than to say, you don't care about people, is really
The
then
bottom line.
what to me that equates to, because you don't have to look around very far to see a lot of people whose health isn't very good. You just don't have to look anywhere, and you see it, of all ages, and, then they would suggest that, well, some lazy person who doesn't work, why would we give it to them? Well, maybe that's why they can't work, I don't know, because sick people don't do very well at work.
Absolutely.
They don't come to work, they,
Who wants to
they
hire
create,
They can't come to work
they
because they don't
create
feel
a,
well.
a liability to an employer in many ways. And lots of employers can't afford health coverage anymore.
And whether they're going to openly discuss that the pandemic has exposed so many shortfallings of our healthcare system, specifically in the rural health area. And so if we don't find a solution, I mean, Kansas had paid out $600 million in fraudulent unemployment claims.
Oh, was that not?
In part of that meeting that I shared with you, I was in the town hall, there was a lady there that shared her story, that she now is unemployed with 2 children, one's autistic, and she was hacked, or had the fraudulent claims against her. She can't get unemployment and has been without an income for 11 weeks with her children. And what the senator said at that point in time, well, he said that he was more of the federal, and he turned and said, well, maybe Bill Riley can help you. And so I stepped in and asked a couple of questions. I said, what I don't understand is, yes, you're federal, but you represent the state of Kansas, all the citizens, and you have a person here that's sharing a horrible experience. So I asked, what is the problem with the unemployment system, the fraudulent claims, and it's a 30-year-old system. And so they had a lot of problems with that, but the thing that I was surprised at is that Kansas outsources its call center for our unemployment to Michigan.
Oh, wow.
So why are we not bringing jobs here? There's a lot of things here that kind of came to the surface in this meeting that I have so many more questions now.
So Mr. Alley, basically, his go-to is always, we don't know what our share is going to cost us. However, if they do penalize us, we're gonna pay more than that little piddly bit that he's worried about, you know what I'm saying?
Well, and that's where, if we go back to the foundation, the Kaiser Foundation is very reputable.
Oh, yeah.
And with their projection of a $250 million savings, you can no longer say that it's gonna cost us. It's going to save us money in 3 years. So that's the most important thing for me to get out and to get with Mr. Ali on, is because you don't get to say that anymore. It's not gonna cost us anything. And, we give so many analogies to people. It's like, you pay state income taxes, you pay federal. Why? It's like Kansas is saying, well, we're getting a tax-free fund, but please give it to my cousin in Texas, because I don't need that this year. I mean, we're literally turning away this money that's going to expand a system, help our citizens and the hospitals. So I just don't see how anybody could potentially, with this new information in the federal reconciliation bill, say no.
Well, and because we have not expanded it so far, I think it's up to $4 billion and counting now, that we have turned money away, our own money. We have just pushed it back, saying, yeah, give it to some other state.
Pam's
Now
trying to make me
that
cry.
doesn't make any sense.
$4 billion, yeah.
It's $4
It's
billion.
devastating.
It's a lot of money. And had it have been expanded, guess what? we would have turned that into so many more dollars because of the way that works. The providers get more business, everybody gets healthier, they stay at work better. I mean, it's
Yeah.
such a win-win. It's hard to believe they can't see it.
And if we don't do it, and I don't know, like I said, I hate to say I don't think it'll happen this year, but if we don't do it quickly,
Mm-hmm.
we have no idea what the ramifications of COVID is going to do to us.
Mm-hmm.
There's so many levels. I mean, if you look at it from the standpoint that we don't know what it's going to do to our bodies,
Mm-hmm.
I've read in the AARP that 50% of people over 50 that have been hospitalized are going to have neurological effects. Well, I'm one of those people. I didn't have, when I had COVID, I didn't have the horrible chest pains and tightness, but my O2 stats were bottom. I would wake up and they'd be 70. And so they're like, they made me come to the hospital. It probably could have been the silent killer, if you will, because once we got in, we found out I had the clotting all through the middle, clots all down the side. I had the epitome of COVID lungs. Then I ended up with COVID mouth. There's 25% of the people get that, and they're just big, deep holes in the sides of your mouth and your tongue. You just never know what you're going to get.
Mm-hmm.
I didn't have a cough, so I tested positive January 4th, was hospitalized the 12th for 6 days. And then a month later, then I started having a cough. 2 weeks ago, I got another virus, and Dr. Herrera goes, well, I'm going to order another COVID. He said, you might have the variant. I said, Mauricio, if I have COVID again, I promise I'm going back to Texas. So I came in negative, but yeah, it's an experience, and I, as the CEO of the hospital, had a different experience than my patients would have, because I still knew the staff that was coming in. But I'm telling you, even knowing that, my heart went out more to my patients, because the isolation of being in there away from your family, where you can only text or FaceTime, and they wouldn't know the staff and be able to chat with them like I had the opportunity to, it's got to be devastating, guys. It's a very alone feeling, and so I'm very thankful that everybody in the room got their vaccines and ready for the second one. The first one, just so you know, they're saying if you got Moderna or Pfizer, and even if you didn't get the second one, they're saying the first one is around the 70% efficacy. So I do encourage you to get the second one, but you're pretty good right now with your first one even. I talk too much, so any other questions?
Yes, I'm from Ark City, and I'd like a little clarification. The clinic on Summit Street is part of the hospital, just like the Ark City Clinic, right?
Yes, ma'am.
Who's covering that building? Who's in that building?
It's Dr. Shazada. Dr. Shazada is internal medicine. He's been with us for many years. Dr. Thompson. Angie Ziegler is a nurse practitioner in there, and then Dr. Green's going to come back into that building April 1st.
Okay. I have another question too. First of all, I want to let you know I appreciate all the work you've done there at the hospital. I know you have made improvements. But I would like to know, do you have a policy on how to handle medical errors that take place?
Peer assessments? Yes, that would be the policy. So
Okay, yeah, can you explain it to me?
absolutely. So there's called peer reviews, and so basically it's a committee that you present a medical complaint to. Let's say that we had Jane Doe that was in the hospital, and we feel like that there was something, the family's complained, it feels like that there was substandard care. So we start the process and we do an internal review with the committee that has a nurse and 2 physicians on it. If it's what we deem that it was appropriate care at that point in time, we can stop there. If it's not, we can send it up to the next level, which is called, and I don't know what it stands for, I just know it's SOC. And then we can either do that internally and have 2 doctors do a full report and then merge the report, or we can go to an outside. We typically have been going outside to the Kansas Medical Society, because we've had such a small group, it's very difficult, in my opinion, to trust that report 100%, because sometimes, you know, Dr. Schmeiler's worked with me for 20 years. I don't really want to say anything bad about him, but so I have both options. If I feel, once I review the report, if I need to send it on up, I will.
Okay.
And so our risk manager also has a process of investigating that too. So we have several systems that we can do.
Okay, anywhere within your process, do you involve the patient or family?
We are actually in the process of reviewing that policy to update it, because a lot of the policies in the hospital haven't been updated since 2014. That's one of the policies that I have talked to that I would like to include the family.
Okay, I would encourage you to check into the Candor process.
Uh-huh.
Are you familiar with
Yes,
it?
ma'am.
Okay. I am an advocate for patient safety,
Absolutely.
and that is a wonderful program if it's implemented as it's supposed to be
Right.
and is carried through with everyone and not just selected patients.
Right.
So,
what we're looking at, just so you know, our process, I don't get to make the policies. So when we make recommendations or revisions, it all has to go for, through the med exec, med staff, and then for board approval. But we are working on that. I don't anticipate it happening in 30 days. I think it's going to be more of a 6-month project for this one. The dress code policy took us 3 weeks just to pick, guys, just to pick out colors of scrubs. I mean, we don't want to wear navy blue in the ER anymore. I'm like, okay. It's just fun. It's comical to me some days on things that I think should be easy, and it's not.
Never
But
is.
what?
It never is.
I know, and there are, and the people that manage our ER, they actually had bought everybody's monogram scrubs, and so I was like, okay. I called Dr. O'Donnell and I said, are you okay if they wear a different color? So, yeah, it's interesting.
okay, well, I would encourage you, and if I could be of any assistance to you, I don't know what it would be, I'd be glad to. But please, once you are set up, make sure the public knows about it.
I have a question. Do you guys use Facebook?
Mhm.
You do?
Mhm.
Okay. We do a lot of Facebook notifications. We've started doing the paper. I've done some mailings. But how best would you guys want us to share information with you?
Newspaper for me.
Newspaper for you?
A lot of
Okay.
people don't,
But
especially
a lot of
lower
people
income
don't.
people do not get the newspaper.
Yeah, that's true.
But it would seem like for patients, if everybody gets something to take home with them,
Yep.
if you have a complaint, this is our process.
Yeah, absolutely.
Absolutely. So yeah, I just want to make sure that if there anything comes to mind though, please reach out to me, because I'm always looking at better ways to communicate to patients, community, everyone, because right now, I truly believe that Dr. Ansari is as good, if not better, than any orthopedic surgeon that you could go to in Wichita. And I would not say that if I didn't believe it. My nurses have come. There's one process in hip replacement surgery where they put in a pin, and 100% of the time, typically a surgeon will change it or whatever. His first he's very talented, very skilled. But he studied in England. He studied under the Cleveland Clinic. He has the foundation and the training that's unprecedented for rural Kansas. I mean, I would anticipate, in my life that I would have met him in Austin, because he's that kind of surgeon. But we're blessed to have him in little old Ark City.
Yeah, and he came from Liberal.
He did
way
come
out
from
in
Liberal.
the southwest
Yeah.
corner of the state.
And it was interesting. His wife, they have young kids, and Farrah was kind of like, she said, I'd like to be closer to either Wichita or to Denver, because they were going both ways. And so it was just a blessing that
It
he
was
ended up
good.
coming here, because we could have lost him to the Denver area.
Oh, yeah.
But it was interesting. when I do recruiting trips, I always have a weekend with the family and kind of get to know them better. And it was a good match for them. There's a nice community in Andover that facilitates their religion, and so it was very nice.
Plus our traffic is much better here than Denver.
Well, yeah, and that's what I was telling you.
Denver's a big city.
Well, and interesting you say that. We've started working with the Anthony Harper Hospital for orthopedics because their patients were all having to go to Wichita.
Yeah.
And I said, no, let's be honest, it's
Come
the
over
same
here.
amount of miles, and if I'm gonna be having to drive to orthopedics, I'd rather go on a 2-lane country road than have to go deal with Wichita. And so I think that was a deal that we've been able to work out with them. We started yesterday out there, holding clinic one day a month.
Oh, that's good.
So,
I think, just like any other, I think if you've ever worked in any not-for-profit area, it's the young families that are easier to recruit than single people, for this area. But it's the families that wanna raise their children in our communities, that's the ones that stay.
Yep, so Lisa has a little 1.5-year-old little boy, and so you're correct, it's a little more difficult. Cora, Dr. Rule, she is single, but she has family up the road, so I think
Exactly.
that'll help too.
Some
like you
kind of
said.
relationship,
Yeah,
Yeah,
connection.
but it's valuable to really be able to get the right people that are going to be here for longevity. The ones that come in, for 2 or 3 years just so they get their rural health paid back to their loans. I appreciate them much less.
Yeah.